And a hello to everyone. Mike Martinego of SportMedBC here. We're so glad you could join us for our first SportMedBC member webinar. Today, physiotherapist and SportMedBC director Mark Rizzardo will present the Concussion Update. Back in late September, Mark attended the Concussion Retreat just outside of Toronto, Ontario. And today, Mark will discuss Solving the Concussion Crisis, a white paper that was presented at the event. The conference itself was an international collaborative effort to address concussion management, science, policy, and future direction. Just before I pass it over to Mark, I want to mention if you have any questions or comments, any feedback throughout the presentation, there's a toolbar on the right-hand side of your screen that allows you to send us questions. Mark will attempt to answer the questions during the webinar. If we run out of time, Mark will answer those post-webinar. As well, this webinar will be posted online, SportMedBC's YouTube channel, and we'll send out a link to the presentation in a future newsletter. For now, I'll pass it over to physiotherapist, SportMedBC Director Mark Rizzardo, who presents the Concussion Update.
Hi everyone, thanks for joining us tonight. So I just wanted to explain how we're going to do the presentation. We are going to go through the slide presentation, and as Mike said, if you have any questions, just type in your questions and we'll try and answer them as we go. So recently there's been an epidemic of media attention to the topic of concussion. And I, like Mike said, attended a seminar back in late September, and it was attended by some of the heavy hitters in Toronto and in the world in terms of concussion. Some of the people that were in attendance were Dr. Jha, who is a neurosurgeon in Toronto/Hamilton, and he actually was the figurehead who started the entire talk at the symposium. He's also the main researcher behind the magazine called Concussion, Current Research in Concussion. Now, some of the heavy hitters that were at the conference is Dr. Robert Cantu, who's involved, and as we'll talk about later, in the research at Boston with CTE, Dr. Thomas Generelli, and Dr. Charles Tater, who's a Canadian neurosurgeon out of Toronto/Hamilton. And the really important thing at this conference was the need for the multidisciplinary advice from other health professionals besides neurosurgeons in this a very important topic. Locally, I've taken a number of slides and information from Dr. Shalina Babul, who's the Associate Director of the Children's Hospital in Sports Injury and Research at BC Children's Hospital, and she's a leader in this field in British Columbia and very quickly becoming an expert in Canada. So as we go along the topic, you can see from the various sports that we encounter every day, things like soccer, rugby, which just held its World Cup over in Europe, skiing, obviously, where especially in the downhill, in the race skiing, there's multiple injuries. You can see that the head is getting squished. Obviously, football in both the CFL and the NFL, which is just in the midst of a major lawsuit and with the Players Association and past players. Synchro swimming, where you wouldn't necessarily think there would be a concussion issues, but if you can see from that picture, people are always moving along quickly underwater and under stress. And there's, some where I haven't included, but there's one in lacrosse in the States, United States. The girls lacrosse is becoming more of an issue. And one of the things that, the sports that you may not necessarily have is like curling, where recently even Brad Gushu, who's a Olympic champion, fell and hit his head and was able to come back after he was cleared from a concussion, but had split his eyebrow open. So things that happen not only in the pro sports, but at everyday life that you may be getting in your child that's playing recreational soccer or football or field hockey down the street from where you're living. Unfortunately, sometimes people just carry on in their lives if nothing is wrong to the outside world, but internally they're having some issues. And I think we have to be very aware that some of the very key tenets of a concussion. So we have to realize that a concussion is a traumatic brain injury. It's just not a knock on the head. Something traumatic is happening to the brain that's encased inside the skull. A lot of people think that you need to get a CT scan to diagnose it, and they have found in numerous studies now that CT scans are typically normal when somebody has suffered a concussion. You do not need to have loss of consciousness to be classified as a concussion. Some people used to think that unless you were knocked out, you did not have a concussion, and that's absolutely not the case. You do not need to hit your head. So if you get some type of whiplash injury, again, it can happen in any of the sports we just talked about. You can get hit violently from the one hit and then somebody else hits you from the other side. You don't have to hit your head on another person's head or another person's part of their body, or on the ground, or on like the pole in a soccer pole. So you got to make sure that you try and get a complete history, which we'll see in a few minutes. Another important aspect to remember is that over 90% of people that have concussions recover in the first 10 days. That's very crucial. I know the media is highlighting on individuals such as Sid Crosby, who was almost missing a year of action in the NHL. But those incidents are very few and far between. But the good thing about, say, when Sidney Crosby got hurt, that it brought a tremendous amount of attention to the topic. And the other thing that we have to remember as we go through this is that pediatric populations, that's pretty well anybody that's under the age of 19. And if you want to get very specific, some people classify pediatrics as up to the age of 16, may take a little longer to recover. So if you read the documentation that, you know, some people get better in 10 days, you might find that the young population might take up to 3 weeks. And is this an epidemic yet? Well, it's reaching that. And I think one of the reasons that it's reaching that is just that it's being diagnosed, and it's part of the everyday talk of people that are participating in activity in Canada and locally. And if you look at the stat I've just got up in the slide now, there's 22% of those that got hurt in BC. 22% of head injuries were hospitalized were children, and those were the kids underneath the age of 19. 16,888 were treated for concussion in the Lower Mainland, and that's a big number. That's almost 17,000 people that have gone on, and it's expensive because those people are taking up emergency spots and then being seen by concussion specialists, leading from a general admissions clerk to neurosurgeons. In BC, we got to make sure that you realize that it is a big factor. I've done a recent talk for the Vancouver School Board where it's a big factor in terms of not only in teams that are playing, but in phys ed programs. And teachers were asking, what are the simple signs that we need to be aware of? And so you can see from the figures that I've just posted that almost 40% of the total of people that were seen with concussions in BC were between the ages of 0 and 19 years of age. So some of the signs and symptoms that you should be aware of, and some of you, this may be old hat to you, but the client may present with cognitive, emotional, physical symptoms, along with later on some very obvious sleep disturbances. And as we'll talk about a little later, many of the athletes and individuals who suffer a concussion may develop some type of depression as a result of not being able to do their activity, which may lead to one of the suggestions in the conference that I attended, that where contrast to what they used to do with athletes or individuals that suffered a concussion, where they would say, go home and rest until all the symptoms go away. They are now saying that you should be a bit more active, especially after the first week when some of the symptoms start settling down. And, you know, it may not be very obvious to you that a person is having some side effects to the concussion, and they may be locking themselves away in their room or in the locker room when all their teammates have left. They may be, stay in their uniform and just try and isolate themselves because they have some of the symptoms still going on and not really looking to expand on it or talk to people about it. Some of the symptoms that you can see from an athlete side of it is that as they come off the field, if you're lucky enough to be at the field, they may be stumbling, they be eye rubbing, or they may shake in their head as try to shake out the cobwebs. If you are lucky enough to get close to them at the time, you can look at their eyes and you'll see why it's important to have a very good look at their eye. They're either maybe a dilated pupil or a constricted pupil, both indicating that there may be some damage in the cerebral cortex. Some of the signs and symptoms that coaches and athletic trainers should be looking for is some dizziness, confusion, forgetfulness, stumbling. The athlete speaks very slowly. They may have some mood swings, and you may see that later on. It can be immediate, but lots of times it's a couple of days later. And obviously, if they have a loss of consciousness, there's a serious situation there. The athlete may express some symptoms to you that include vomiting or nausea. They're experiencing a headache, which is the number one thing that people complain about. They seem to be off balance. That's why that you may have seen them stumbling. If you do a CAT exam, a SAT exam, which is we'll go through in a minute, they may present as confused. They have some blurred vision, again going back to the visual acuity problem. They're feeling not really up to doing things, feeling sluggish, and a couple of days later they may actually feel like they're losing their appetite. What's key going back to the MRI need is, do you need to have an MRI? No, you do not. A concussion is a clinical diagnosis that's founded on the following principles. And just make sure that when you're going through the history, the symptoms that we just identified a few minutes ago, or some of the focused exam, that you are watching and trying to get the athlete to explain to you if they can, or someone that saw the injury explain exactly what happened. So if you're seeing them in a situation where you're not at the field and you're seeing them in your clinic or at the hospital, you make sure you try and get the mechanism of injury so that you can try and decipher if that's part of the problem. Another key component to the assessment, and when you're looking at the history, is does that athlete have a previous injury, especially a concussion? It doesn't mean that the person will get a bigger concussion. So if you have a second concussion, that lasts maybe 10 days, a first concussion that lasts 10 days, the second concussion could be only a few days, or it could go on for months. But knowing their history is going to be very important in terms of the treatment that athlete might get. There are about 300,000 sports-related concussions every year, but the key fact, if you look at the bottom of the slide, is that 56% of the players said they would hide their symptoms so that they can stay in the game. And that's very crucial. So the athlete may lie, not give away, especially as the athletes are getting smarter. They're finding very quickly that they are not experiencing a headache. And you can't call them a liar, but if you are looking for the symptoms we were talking about before, maybe the athlete will be able to come clean with it. So some of the symptoms that they may come out with when you're filling out the SCAT exam is that they may tell you they got a headache, they're irritable. One of the key ones that I found very good is heightened light sensitivity and heightened noise sensitivity. So they want to put headphones on, they want to wear glasses so the light isn't as bright. And the key one again we see there is depression, and you've seen it in the pros where Rick Rippon for the Canucks, as everybody's assuming that as part of his history of concussions. Those kind of things, you don't want them to get to that point. And unfortunately, some of the coaches, they do not allow their athletes to train or be around their healthy athletes. And they say, okay, we don't want you to come to the rink to get treated, or don't come to the training sessions if you're not feeling well. We don't want the other athletes to see you ill. And that's not highly recommended. Let the athlete try and be part of the team as much as they can. Some of the things that really are red flags, and if you're an athletic therapist or a physiotherapist or a trainer and you're covering a team and the athlete starts indicating these red flags, such as the neck pain, increased confusion, irritability, they're having any type of seizure and convulsions, hopefully you know their medical history, so if they're epileptic or anything like that, you already know that going into it. They all of a sudden get some tingling in their arms and legs. They continue obviously to have loss of consciousness as a major issue, but their headache now has gone worse. So if they started with a headache of a 7 out of 10, 10 being extremely bad, and they now say they have a 9, start thinking of transporting them to emergency care. And also another red flag would be if they experience some double vision. When you're doing the focused exam, now you're off the field, obviously, and you're going to do a normal neurological exam. So for those of us that are in the medical field, you'd be looking at myotomes, dermatomes, reflexes. Those are all indicative, any problems with that there's an issue and you need to have a specialist have a closer look at them. You would also look at their cervical active range of motion, their tender, are they palpating properly? If it's tender on palpation along the cervical spine, then you got to make sure that there's no fracture and there's nothing else going on besides the neck. I will say that a majority of the athletes that I've treated that have a concussion, there is a cervical component to it, and so you sometimes have to treat both the cervical issue as well as what other problems the athlete is having. Another way of testing balance, which is, people are stumbling, things like that, is to do a very simple balance error scoring system. And what I've shown here now is that the athlete standing on one leg on a terra firma, it'd either be a ground or the gym or something like that, and you count how many times they lose their balance, they drop their knee more than 30 degrees, and you actually count how many times out of a 20-second time limit, and they do it on a firm ground, and then they do it on a foam, and you compare to see if there's any big difference, and you do it with your eyes open, but eventually you need to do it effectively, you need to do it with your eyes closed. So you're doing it with one leg there, then you also do it with heel toe, and you're exactly the same thing. You're just watching and monitoring them do it, and you do it with your eyes closed, and you're keeping in track and how they're proceeding. As you can see from the diagram I've put up, the eye has major pathways in the brain that not only go from the back of the head, but go through the entire brain. So when you do the vestibular exam, vestibular ocular motor screening, you're looking for a various number of components. One is the smooth pursuits, where you're following a moving object. You're following the eyes following a rapid eye movement. You're looking at horizontal vestibular ocular reflex that stabilizes images during head movement. And sometimes some people have taken that's how they treat the problem. They actually put them in a centrifuge kind of thing. The visual motion sensitivity related to dizziness, is there a problem in the inner ear? And then a near point of convergence distance where eyes can hold together without double vision. And again, you're getting the athlete to follow your finger to the midline. There's a test out now. It's a visual test called the Vic Test. It's been actually out for a long time. It's a time test which involves, as you can see in a few minutes, rapidly reading a number of letters, numbers, and the CFL and the NFL are trialing it this past year. The NFL is in the middle of it. The CFL is done. I know that the data analysis for the CFL has not been made public, and that will hopefully happen in the spring. What the exam looks like, if you look at the top left-hand corner here, the person, there's arrows here, and they follow and they'll read out the number that goes from left to right and then down to the next line. And they're on separate flip charts. So this would be page 1, and then the person, and it's timed how fast can they finish that from the top left-hand corner to the bottom right-hand corner. Then they flip chart it, and you go to the next page, and again, without the arrows now, the person reads out numbers from the left to the right, and then you go down each row until you reach the bottom right-hand corner. And then the next line, even though it's still a line, there's nothing, no lines connecting the dots, but they would still read from left to right and drop down the line. So it's way more difficult. And then the final page is, extreme focus needs to be done for the athlete to read the numbers from left to right, row to row, again from the top left-hand corner to the right. They're very confident. They're expecting that the reliability is extremely high, and the correlation between diagnosed concussion and people that do well or poorly in this test is going to be extremely high. So the King to Vic test screens for rapid eye movement, the attention span of the athlete. Is it better or worse? Is it concentration there to be able to do the test? Can they orally explain the number? Can they read the number? And so it kind of encompasses a lot of the different issues that are going on. And you can use a pen light, if you're going to do a sideline test, or if you think there's a problem, then send them to an ophthalmologist to get checked out thoroughly. Then there's the exertion test. For a long time, people thought it was, once the person got their heart rate up, that the symptoms would come back. And but now they're thinking that it's actually the things around the activity that the person does that's causing some problems. So when you're dealing with the athlete, there's different issues. One is, do you remove the athlete from play? That's the first decision, and it should be fairly straightforward in terms of does he have a concussion? Does he have any of the symptoms we discussed? Then he should be out. And then the big problem is, when do they go back? When do they return to play? Make sure that you realize there's a lot of risk if person goes back too early. So if your person goes back too early, there's a greater risk of a second concussion because you're not really ready for the hit, maybe, and that can lead to a situation where they called many years ago second impact syndrome. It can quickly lead to death, and it should not be considered at any time. So if the person has any symptoms, they should make sure they stay out. You want to make sure that the person has no symptoms. Again, trying to make sure that they're not lying about their injury just so that they can play. And I think everybody agreed at the conference that if there's any doubt at all, that the athlete should sit out. So once they've been taken out of the game, their return to play is dependent on a concussion expert, and they don't mean that concussion expert did not classify as a neurosurgeon or an emergency room doctor, as anyone that is in the medical field that handles concussions on a very regular basis. Make sure that you realize that concussions can affect everybody's life. Doesn't matter if they're working or even studying. The athlete can't concentrate, and as we talk about in a few minutes, the educators are a big component to the person responding. And sometimes you have to remove them from school or from an education situation so that they can give their brain a rest. And they also have to turn off some of their electronic apparatus, such as iPhones, computers. But one of the things they did talk about at the conference was that if you take everything away from an athlete or a young adult, then they're totally dependent on communication with their friends, so their iPhone, their computer, things like that, then that could lead to depression itself. So they do say, maybe limit how much they can use it to 5 minutes an hour or things like that, where the person does have communication with his friends but is not isolated. So who's responsible for the education and the decreased amount of number of people that are getting affected, and who can help with the rehab? Well, first of all, players have to look after themselves. They have to take some responsibility, and they need to understand what a concussion is and how it occurs. And I think that's where we have to get to the grassroots and start educating them very early. They need to understand what the symptoms are. Just go through the list that we talked about And even young kids that are 5 or 6 years old can understand those. And you need to understand the importance of acknowledging a potential concussion. Give them, what can happen if you hide the fact. Don't be afraid to hide the fact. Nobody's going to be mad at you if you can't play for a week or two. Parents, make sure that they understand they're central to the management of their child's concussion. They should, being very aware of the child's movements day to day. And if they think they're not sure if there's anything happening, they should seek medical attention. Again, it doesn't have to be a family doctor, but it can be a therapist they trust. And then if there's recommendations, like if a person goes in and they feel there's a cervical component, does the child follow through with this treatment? If they're 4 or 5 years old, they may need a refresher every day. If they're 15 or 16, you might want to say to them that they need to take control of their rehab themselves. And another big factor are coaches. And this not just pro coaches, but where more and more people are involved as community volunteer coaches. They should know the principles of concussion management and how the return to play works, and to look for symptoms and especially some of the red flags that may not be available early on. They need to be knowledgeable in the high-risk activities that they specifically are involved in. So if they are involved in trampoline, say, then that's a high-risk sport where easily you can get concussed. Or football, make sure that the shin straps are done up properly. Try, where possible, have the athlete compile a pre-participation information sheet and take appropriate action if a player sustains an injury. And what that means is that the player has to come out and not go back in. When they're returning to play, make sure that they're following the general protocol that Parachute and some of the other companies have recommended and some of the experts have recommended. And you start off, as I've noted here, from having on day one where there's light aerobic activity, and every day you increase the type of activity the athlete is doing, remembering that if any symptoms reoccur or get worse, then the athlete goes back to the day before and starts all over again. And so if they're on day 3 and they're doing some drills that do not involve contact, but they're starting to get a headache, then they stop immediately and they take the 24 hours off, go back to day 2, and see if they can get there and do that activity with no headache, and then they start the process again. Make sure that the athlete does not recover in a pool. They should not be swimming during recovery for obvious reasons, that if they black out or get dizzy or disoriented, that they have a catastrophic result of drowning. So make sure that they're not doing that. Information that you might use, do people benefit from using headgear? You'll see athletes use that in soccer. You'll see athletes use it in different sports. And the answer is that the research on those apparatuses are not done. They're not positive, they're not negative, but they are not eliminating the problem. In some sports like lacrosse, a lot of the athletes are wearing them. If you look at this picture where they're playing in the States, every athlete is wearing a helmet, protective helmet. Is it bad? I can't say it would be worse. And does it prevent the athlete? Look at these players. They're wearing goggles. They're wearing the helmet. They're wearing probably a mouth guard. All those things help. Now, some of the research that, between using a mouth guard and not, especially in sports like basketball and football, have not shown that they reduce concussion. They do show that some people have reduced the impact on the TMJ joint in the jaw, but not necessarily reduced the person getting a concussion. There's a brand new helmet out that's been by Radel that was used for a number of universities this year in the NCAA. Arkansas, Florida State, and amongst a whole host of other universities are on trial basis. And what happens, the two key things here is it's a better fit. The chin strap is molded almost to the athlete's jaw. But the other thing is that it's a sensor, and it gives out information to the coaches or the training staff that was a severe hit has happened without the athlete necessarily motioning. And if that's the case, they may be returning, taking the player out of the action. The research on that will be very interesting. This was 2015 was the first year of it, so the season is almost wrapping up in NCAA football. and it'll be interesting to see results. I'm sure that the Radel will be keen to put out next year. Many believe that neurocognitive testing of some type is mandatory for a return to play. That's not 100% by everybody. Like I said, 90% of the athletes get better in the first week to 10 days. So I'm not really sure if neurocognitive testing is mandatory. Companies like Parachute and Impact all have types of tests you can do online. Some companies are actually doing a baseline testing and before the season starts, and then they get the athletes to do retest during the season if they get another issue. Recommendations to leagues around the world from the conference was that education and prevention surrounding concussions at the grassroots is urgent to prevent declining enrollment, because parents now are saying, if you're going to get a concussion playing football, I want you to go swim. If you're going to get it playing lacrosse, then I want you to go play another sport that's not so high risk, say baseball. Multidisciplinary teams are used for post-concussive syndromes. Again, do you need to have a therapist look at their neck? Do you need to have an ophthalmologist have a look at their vision? Do you need to do specific balance exercises, etc.? So there's various different health professionals that are involved in the treatment of concussions, and you can make sure that they're part of the team that's doing it. In the future, where we're looking at, there's genetic disposition to concussions. So they're going to do some DNA testing and see if there's, and that's already happening around, not only in North America, but around the world. A really interesting one for me was that a couple of companies presented, and they are saying that there's going to be biomarkers appear to be coming very soon. That means you could take a simple blood test that would confirm that the athlete has sustained a type of concussion. And that's possibly only 1 or 2 years away. It's very similar right now to people that have cancer. They do a blood test looking for the marker. Everybody's pretty excited about that part of future for concussions. Make sure that you understand now that the majority of people doing treatment for concussion is that they're recommending treatment rest initially in the first week, but as the athlete gets slightly better, to encourage more of an active lifestyle, so they're not just sitting in a dark room for weeks on end and not communicating with anybody. Again, reason for that is that we want to limit the onset of depression, which is obviously a side effect and not a very good side effect. One of the biggest presentations, things I wanted to get out of this, is that people are aware that there's Dr. Shalina Baboul is very involved in the concussion awareness training tool, and you can go online at www.cattonline.com. It gives you a series of things you can look at in terms of, and it's for educators. How do you treat these athletes when they come to your school? How much time do you have to give them off? What are the recommendations? And you can see from the slide I've just put up, it gives you restricted cognitive activity. What should you do on day 1 or the stage 1? And there's the gradual reintroduction of the cognitive activity, etc. So there's the 5 stages, where the 6th stage is school full time. That could take a week, it could take a month, but there's some very good suggestions in there. And it's the same thing in terms of activity, very similar to what I just outlined a few minutes ago. And so the teacher and the athlete and the coaches are all working together. One thing that's very key, they said, if the athlete is not back at school full time, they should not be returning to their sport. And so people should be working together to present the best case scenario for the athlete. One thing that came out of the Zurich, which is the latest international conglomerate collaboration in Europe, is that they came up with a SCAT3, which is the test that shows you can test people on the sideline, but also there's a child-specific SCAT3, and it's, the language is easier for the child to understand, and you definitely should look at that. And it goes up to a child of 13 years old. There's various journals that are specific on concussion. British Journal of Sports Medicine, Sports Clinical Journal of Sports Medicine there. And I think one that I didn't put up there, but I think it's a key one that's going to be very, very important as we go along, is the journal called Concussion. And there, the reason I put up this slide on the SCAT3 is that if you look at the top right-hand corner, you see different international bodies that are related, that are involved in all the research. And FIFA, which is the soccer international body, the IOC, which is the Olympics, obviously, the International Rugby Association, the International Hockey Federation. And you can see from all the participants that it's a worldwide problem. I did want to touch very quickly on the CTE. It's been in the news the last few years, and Dr. Robert Cantu is involved in this out of Boston, and he's looking at the chronic traumatic encephalopathy. And you unfortunately cannot know if the athlete has this until they do an autopsy on them. A lot of the athletes have started. So Mike Webster, who played for Pittsburgh as a center, died at, I think, the young age of 50, was one of the first people that they found it in. And just recently, Frank Gifford, who was one of the NFL players and announcer, he died at the age of 84, and he also had it. So some young players have had it. There's a young hockey player that I'm not going to go through it. There's a legal case going on, but he was 35 years old and he died recently, and his family are saying that he suffered from this as well. So I think I want to wrap up by saying that make sure you look after athletes, make sure you look after your children so they can splurge and play and eat some great pasta in Brazil as they're looking at the Olympics. There's the Olympic Village right over to the side here. This is where the athletes are going to be living, right around the street here. I was down there a couple weeks ago. And I'm hoping that very few, if any, athletes suffer a concussion at this beautiful city of Rio de Janeiro. And remember that it doesn't matter what you get your athletes to do. If you're confident in what you're saying, they're going to do it. And here's my badminton players that I travel with. They're in an ice, which is like 6 degrees. They're in there for 8 to 9 minutes. And do they like it? No, but they'll do it because they want to perform better. And I think if you talk to your athletes about concussion and give them an education, they're going to follow your lead. So if you want to look at any recent references, there's Parachute Canada is very good. Dr. Shalina Babul, who's at BC Children's Hospital and is at the Concussion Awareness Training Tool, you should look up. And if you follow Concussion, spelled with a K, Dr. Jaw is one of the leading researchers in Canada on it.
And thanks to Mark Sardo on his presentation on the concussion update. Thanks to everyone for tuning in, passing along their thoughts. I think there were a few questions towards the end there that we weren't able to sneak in as we went a little over time, but we can get to those via email. Want to mention as well, SportMedBC.com. If you check out our sports safety page, there is a new concussion information area that has a variety of tabs that include workshops and management, resources and links, so be sure to check that out. We're looking to have another SportMedBC member webinar early 2016. If any practitioners are interested in presenting in the near future, please drop me a line at mikem@sportmedbc.com, and be sure to visit sportmedbc.com for the latest on our organization. For Mark Rizzardo, I'm Mike Martinego. Thanks for tuning in to SportMedBC member webinar.